good evening. My name is Carol Howe. I'm with women voters of the Uncompahgre Valley, which serves the counties of Delta, Montrose, and Ouray. On behalf of the League of Women Voters and the Center for Mental Health, I welcome you to tonight's seminar, Suicide in Youth, Saving Lives in Our Community. The League of Women Voters is a nonpartisan political organization that encourages informed and active participation in government. We influence public policy through education and advocacy. We have two separate and distinct roles. We present unbiased, nonpartisan information about elections, the voting process, and issues, but we never support or oppose any political party or candidate. We are nonpartisan, but after study, we use our positions to advocate for or against particular policies in the public interest. The League of Women Voters has had a position on healthcare since 1993 and has advocated that a basic level of quality healthcare should be available to all U.S. residents at an affordable cost. After additional study, this position was expanded in 2016 to include providing access to a basic level of care for mental health on a parity with physical health care. We are very happy to co-sponsor tonight's program with the Center for Mental Health, which will provide information about suicide and prevention resources available in our area, with a focus on the collaborative efforts within our community to prevent youth suicides. I will now hand off to Laura Byard, Clinical Director with the Center for Mental Health, who will introduce the other panelists and describe the format for this evening. Laura?
Great. Thank you so much, Carol, for having us and for hosting this presentation. We're very grateful to the League of Women Voters for doing that. As you said, my name is Laura Byard. I'm a Clinical Director with the Center for Mental Health, and I get to work with a lot of agencies, as we'll tell you tonight, but primarily with the Montrose County School District and the Montrose Police Department for our suicide prevention program and student threat assessment program. So I will pass it over to these guys to introduce themselves.
My name is James Pavlich. I'm the Executive Director of Operations for Montrose County School District, and I oversee our behavior processes and our threat and suicide risk assessment programs.
Great, thanks. Thanks for having us, Carol. We really appreciate you giving us the opportunity to talk tonight. This is very exciting, and I'm thrilled. So my name is Matt Smith. I'm the patrol commander for the Montrose Police Department, and I've been with Laura and Jim on the threat assessment team since its inception here at Montrose. So again, I'm very excited to be here, and thank you guys.
For those of you listening tonight, if you have questions, please put them in the chat or the Q&A box, and we will get those answered for you as well. So thank you for being here, and we appreciate it. We are going to share some slides with you and go through our presentations. Okay, so we are the West Central Colorado Student Threat Assessment Team, and that team is really made up of many agencies across our 6-county region. So that's why it's the West Central Colorado Student Threat Assessment Team.
We started this team 3 years ago now. This is our 3rd year of operation, and we're going to start off with a little video for you that kind of gives you our origin story.
Safety is always our most important priority, and we will do everything we can to keep the students and staff of our school district safe.
We now have a prevention-based threat assessment model that will support students in crisis. If you have a concern, report it. We will take care of that kid and that family, and we will keep our community safe.
Threat assessment teams are endorsed by the National Council for Behavioral Health as the best prevention for mass violence. As a parent, I know that my kids are in a school district where their safety is being considered and taken seriously, and as a community we're coming together to support them.
So I'm Officer Travis Booth, and I've been a school resource officer for going on 13 years.
So the threat assessment has always been in effect since I've been an SRO.
sometime last year, Jim Pavlich started searching into Cmdr program. It's a threat assessment program that's known nationwide.
We brought in the John Van Driel and Alan Rainwater, two of the authors of the book, the Salem-Keizer Threat Assessment Model, to train our community in how to do this Salem-Keizer threat assessment process. Essentially, last year I was new to this job. Chief Hall took over the Montrose Police Department and Sheriff Lillard took over the Sheriff's Department. So we were all talking about threat assessment because during our grounding, our trainings for the new positions, we got to interact with the FBI's Behavioral Analysis Unit. We asked them what they thought was a good model for community threat assessment, and they mentioned the Salem-Keizer model. They said Salem, Oregon is doing it right, and they've been doing it right for about 20 years.
The threat assessment process that we've chosen is one that is community-based, that is a prevention model, that is very forward-focused. If we are looking for an avenue to best protect our youth, our community, our kids, and ensure that our youth in our community who are struggling, who are making threats, are cared for, then this model is one that, as the center, we believe is going to be successful.
Our most important job is making sure your kids come back to you at night, and we are committed to doing that right.
We want families to know that our community is working together to meet the needs of all children and that some challenges should not be faced alone.
Right, so like the video alluded to, we obviously recorded that video a couple of years ago. So that was done in the first year after we did it. We've been doing this now 3 years. And what the catalyst for the school district was on this was, I was out in at the state legislature testifying before the Senate, trying to get funding for safety-related projects in Montrose. And as I was driving back to Montrose, the Parkland shooting happened. And in the months following that, really in the 30 days following that, we ended up having kids processing poorly and making threats to school. And it ended up being around 13 kids that we expelled that year. And that's how I met Laura. Actually, I called over there because I was trying to figure out how to determine if these kids were safe to be in school. My first conversation was a little wonky. You know, we were speaking 2 different languages. I called her up and I said, can you assess these kids and tell me if they're safe to be in school?
Yeah, absolutely. And that's not a service that mental health clinicians provide. We can't foresee into the future. We can assess and provide support and treatment. And so it was really a challenge to figure out how to meet the youth and their families' needs at that time when we didn't have these collaboration in place.
Yeah, I talked to the law enforcement. I said, well, can we charge these kids? They're threatening to bring a gun to school or to attack the school. And our SROs, you know, they reached out to their commanders, and this is what we found out.
Yeah, so what we discovered is a lot of times some of the instances for which kids are expelled don't necessarily rise to the level that criminal statutes allow us to make a charge. So in that respect, and some of the expulsions that we saw, our options were very limited from a law enforcement perspective. And it also brought to light the fact that even when we do bring someone into the criminal justice system as a juvenile, their options are limited as well, and it's not a long-term solution at all. In fact, many times when we go through the screening process to see where these kids who have been charged with criminal offenses go, they may screen back to their home if the juvenile intake screeners deem that a safe place for them. Or if they get housed, it's for a very short period of time. So in either case, that juvenile, whether they're charged or not, is going to be back into the community without a lot of structure.
And so I stewed on that. We actually ended up expelling those kids, about 13 of them, for 365 days. And so you see on there in that bullet under after Parkland, they didn't meet criteria for charges. And really, on the mental health side, they couldn't do a screener for the school district that said these kids are safe to come back to school. So ended up getting moved in this position, actually the safety and security position here at district, and had a conversation with Chief Hall in January of 2019. So we had these kids that we expelled, and we didn't have any real way to figure out if they were dangerous. We spoke different languages in our agencies. I literally with Laura, it was like we were talking like two trains passing each other in the night. Found out we really didn't speak the same language. And so I had that conversation with Chief Paul, and he said, hey, we need to do community threat assessment. I said, I agree totally. And he says, let's have a meeting. So he got us, the Center for Mental Health, the Sheriff's Office, and Montrose PD together, and we called the Behavioral Analysis Unit in Carlisle. And they said, like we saw in that video, hey, check out Salem. So I said, you guys want to go visit? And we did. And Laura, myself, Matt, and Officer Booth went up there and really liked what we saw, because in Salem, we saw a group that really did speak the same language, that really focused on, instead of trying to say how likely was it that the threat was going to actually happen, they focused more on whether the threat was targeted or reactive. And then they, as a multi-agency group, focused on prevention and supporting that family and involving the guardians throughout the whole thing. We also saw they had a suicide risk assessment team. We were driving back to the airport. Matt and I were talking about this yesterday, because we did a training here in town for our principals and counselors and community partners. And we were driving back to the airport in Portland after visiting Salem, and Laura looked over at all of us and said, hey, they've got a suicide program up there too. It looks the same thing, level 1, level 2. What did you guys think of that? And we were all like, yeah, it seemed good, and Laura said, well, I think we should do it. And I'm like, okay, because I'm thinking, yeah, that'll get the center on board. And little did we know that was really going to be the bigger lift, and also the more impactful component. Like, we touch a lot more families with the suicide team. So we entered into this with 3 main goals, and a realization. The realization was threat assessment is not a one and done type of deal. It's an evolution. It goes on over time. We were with these kids really for the long haul.
Yeah.
We had 3 big goals.
Yeah, absolutely. So from the law enforcement perspective, our primary goal, when we really break it down to the nuts and bolts, is to provide for the psychological safety of our community, our school staff, students, and their families. So that includes everyone, even folks with whom we work in the threat assessment team. They need psychological safety as well. So that's one of our chief goals, and something that as we work forward, we think of every time we work with someone.
Yep. And then also, secondly, we really needed a way to address our concerns around the growing youth suicide rate nationally, but specifically here on the Western Slope. And so a way to partner together and to care for our kids when they need it, and to provide that service at the school as well as in the community.
Finally, from the school perspective, one of the most important things for us is to safely return students to school as quickly as possible following a suspension or expulsion or a psychological crisis. Like, we needed a way and a protocol for our to be able to implement across the system to bring kids back and make, speaking back to psychological safety, make sure that everybody felt like understood why we were bringing them back. By law, we're required to have these threat assessment teams and to have programs for screening youth for suicide risk. So this model met that bill. One of the biggest things up there that impressed us is everybody used the same jargon. It didn't matter if you were talking to a law enforcement person, a community mental health person, a diversion, a probation, a judicial, or what have you, or child protective services. Everyone was out there. They were talking level 1, level 2, level 1, level 2, and essentially, what the level 1 team is the school level team. It has, if you think of it as a stool, it's got 3 legs on it every time, non-negotiable. That leg is the school administration, the school counseling office, or the mental health representative at a school, and the SRO, or law enforcement. So law enforcement, school administration, and counselors. And that level 1 team is informed by parent interviews, student interviews, teacher interviews, and witness interviews, as well as records reviews. So they get together at the school site and own, because it's their kid, they decide, do they have more questions or can they handle the kid at the school level? If they have more questions, they kick it to a level 2 team. You know, level 2 has kind of 2 different tracks, depending on if you're in the suicide protocol or the threat protocol. In the suicide protocol, we utilize the Center for Mental Health for support. So level 1 assessment's done, they have concerns or more questions about that child's safety, they kick it to the crisis stabilization unit here in town who does or mobile response, and they do an evaluation and we elevate that kid to a higher level of care. On the level 2 side of the house, for threat assessment, it goes to a community team. So another investigation is done, and then the student threat assessment team, the West Central Colorado student threat assessment team, staffs that child.
So I think it's really, I think Jim's right, like the shared language has made a huge difference in our ability to partner together to support a family, because we all do come with our different protocols and abbreviations, just like any agencies does. But one of the things we have found over the years that we've been doing this is that the threat assessment team really allows us to serve the whole child. And so we call it an "and" program, because we can take care of their mental health needs and their school needs, and we can address their legal needs if that's an issue. It all works together and supports the whole child and the whole family.
So you see there, you got those 4 arrows, and that's kind of what that's talking about. Each one of these processes works in tandem with each other. You know, I'm not telling law enforcement what to do. Law enforcement's not telling me what to do with the discipline process, and mental health is working all together and in parallel with a kid on threat assessment. I kind of mentioned this on the last slide, but you see the different interviews, the different basic information that goes on before they get together and work through a 21 question protocol on that student. Again, you see the members of that team. The level 2 team is really a community collaborative. You know, we've got Montrose County School District, a variety of people from the school district there. We've got the Montrose Police Department, the Montrose Sheriff's Office, the Center, DHS, Hilltop, 7th Judicial District, the Northside Health Clinic here, and the Uncompahgre BOCES, which is our 5 districts to the south of us, are also participating every week in this level 2 meeting.
So as we all know, there's a tremendous loss when we experience the loss of life of someone we care about, someone in our community from suicide. It's a national crisis, as I stated before, and Colorado is 5th among the US. Suicide is one of the leading causes of death for our youth, so incredibly critical as a public health issue that we have a way to support our kids and to intervene when they're experiencing suicidal thoughts or suicidal crisis. Just to put that into context, there's about 25 attempts for every documented loss of life from suicide, so tremendous pain and opportunities to intervene. From each death, we know that there's 135 people exposed on average. 53 of those people will have a short-term disruption in their life from that loss. 25 will have a major disruption, and 11 on average will have a devastating impact. Every one loss has a lasting impact on all of us. On the right there, you can see a map of the US, and on the Rocky Mountains in the west, you'll see that the suicide rate there is higher. So that's why it's critical for us to address this issue. There are some risk factors that I want to just mention tonight, and we're also going to talk at the end how you can get help for someone, so please know that. And you can put it in the chat, and our team will respond to you as well. So some of the risk factors for our youth, because youth are who we're specifically talking about today. Our LGBTQ youth are at higher risk among our adolescents who are already at high risk. If they're experiencing discrimination, rejection, isolation related to their LGBTQ status, that makes them at higher risk. So be mindful of that. any prior suicide attempts, that's our youth at higher risk, use of alcohol or drugs, mental illness, of course, access to lethal means, and we'll talk about that in a little bit, knowing someone who's died, and particularly a family member, but we know that even if they know someone who has died who is not a family member or even a close friend, just knowing someone puts someone at higher risk. Isolation, limited access to care, if they have a history of stressors, trauma, bullying, abuse, those things are things we want to talk with them about and consider, and any chronic diseases or disabilities. Just because those are up there as risk factors doesn't mean that those are the only risk factors, or if you don't have those, that your loved one is not at risk. We just put those out there to note that those are things to look for. But if your youth doesn't have any of those things, they could also, of course, be at risk as well. So just being mindful of that.
I think one of the things that stood out to me as we're getting into the data next, but as we've implemented these processes across the district, is that every demographic of our community has youth that are experiencing suicidal ideation, that are struggling at times with thoughts related to suicide, and we're still combating within our community kind of a stigma about that. Like we got to get folks past any shame attached to the fact that a family member or one of their children experiences suicidal ideation. We, without a doubt, us talking about it reduces risk. We're seeing that in the schools.
Yeah, and I would say, I think we mentioned it in a little bit, but just in case because it's on my mind right now, perhaps we could pop into the chat a link to classes. We offer classes if you're watching this and you're interested in how to learn more about talking with someone about suicide, or if that's something that makes you uncomfortable. We have a class called QPR, Question, Persuade, Refer. That is a 90-minute class and it's free, and you can sign up and learn more about how to have that conversation. And then we have other classes as well, like mental health first aid, if you're interested in that. So please sign up for those classes as well.
So right here, you kind of see our data related to our student threat assessment team and suicide risk assessment team. This started for threat, we started doing threat assessments in September of 2019, in the fall of 2019, and we started doing suicide risk assessments like a couple in November of 2019. So this is 2 years worth of data. We held off publishing our data until we could norm it against another year. Of course, it ended up being kind of a crazy year, the second year of implementation with the pandemic. And we did see things trend a little less, like we didn't have as many assessments during 2020-2021 school year. But overall, we've assessed 297 youth in Montrose County District for suicide risk. About a quarter of those went to a level 2 crisis evaluation. On the threat side of the house, we've assessed about 132, not about, actually, that's the actual number, it's 132. And about a third of those went on to a level 2 investigation. So what that equates to on kind of a daily basis for us is we're gonna run around 4 or 5 suicide risk assessments a week in Montrose County School District. And at least one of those is probably gonna go to a level 2, some weeks more. And on the threat side of the house, we're gonna do 1 or 2 threat assessments a week, with every other week, one of those probably going to a level 2, which means they come up to that community level response.
I was going to say, I think it's important to note there that we do assessments all the time, and that the bar for doing that assessment is really low. And so just to kind of mention that along with the data, that if anyone shares a concern, this is the way in which the school district and the center and law enforcement would gather more information in order to know how to help that child, or if we need to help that child or their family.
Basically, I always tell folks, if you're still thinking about it an hour after you talk to that kid, or that you heard from your son or daughter about that kid, you should report it. And we'll get into the different ways you can report it. And we're going to do a suicide risk assessment or a threat assessment, because in the worst thing that comes out of that is we know a lot more about that kid and that family, and we determine there's no risk. So we want to hear if you're concerned. We've done 100. So yeah, the bar is low to get in. So into the process.
At the same time, in 2019, the Center for Mental Health was able to open the Crisis Walk-In Center. If you're not familiar with that, it's a building it's beautiful. It's located at 300 North Cascade. And in that building, there is a walk-in center that's open 24 hours a day, and a support line. And we'll give you that number in just a second, or we can put it in the chat. Since we opened in the fall of 19, we have some numbers there for the number of youth that we've been able to assess and support at that crisis walk-in center. We also have a stabilization unit where youth can stay overnight, and we've been able to support 90 youth here in our community who needed that service. Prior to opening of the crisis walk-in center, the youth needed an overnight stay related to their mental health crisis. It would be out of town. So this is a really great service. It's a voluntary unit and allows our youth and families to be supported here locally. We also, and I'll let Matt speak to, we have a co-responder program, which also provides support here in our community in a partnership as well.
Yeah, absolutely. So the co-responder program for us has been, I don't use this term lightly, but revolutionary in how we can deal with people who are in mental health crisis. It's traditionally what would happen is someone would see someone or hear someone or know someone who is possibly in crisis, and they would call us and we would show up. And not always would this happen, but sometimes it would happen that we would escalate a situation or maybe not be able to give that person the help that they need. So with the co-responder model, what we've done is we have a clinician that actually is embedded with our patrol division, so that when we do have a call or an incident for service where someone is experiencing a mental health crisis, that person can help us assess what best connection we can make for that person to receive services. A lot of times we're not the help that those people need, and we want to be in a position where we can provide them services and help. And this has really allowed us to do so. The program has been amazing for us, and it's given us a lot more options. It's had a lot of ancillary benefits too for our patrol officers. I think we've become more analytical in situations like this. So we're less likely to think of things in a law enforcement frame of mind. We're able to slow things down and really work toward coming up with a solution that helps that person that is long lasting. So the co-responder program has been great for us. It's been amazing.
I also feel like on this slide, we really should have the data about how many safety tells you guys respond to.
Oh gosh.
Because, you know, with the state safety tell system, which is an honest reporting system we'll talk about more later, our patrol and our deputies, so our patrol and our deputies are responding to families' homes all hours of the night when we have concerns for suicidal ideation or threat.
We have a question in the Q&A, and it might be a good time to answer it. And this might be for you, Laura, or maybe for you, James. What is the age range for youth to be eligible or appropriate for assessment and support? School
age. So for us in Montrose County School District, that means pre-K-12. We have processed kids from all levels. You know, I can't even say we do more secondary than elementary. We do more suicidal ideation at the secondary level, so 6 through 12, but threats kind of span the gambit. And we do suicide risk assessments at the elementary level. Not as, you know, it's, but yeah, no, this is appropriate for our whole population. I will tell you the protocol looks a little different for our elementary school students than it does our secondary, but no, we work through our entire population with this. And this graph here, you know, we kind of didn't talk about it, but you know, we do 3 suicide risk assessments for every threat assessment. That's kind of what I was referencing. Well, Matt and I chuckle about every now and again. Like, you know, we didn't really didn't realize how great the need is in our community. You know, I think that number, I know we're leaving here a long time. But that number, that 297, you know, that's 297 conversations with families about suicide and you know, breaking down that stigma, which I believe is making our community safer.
Yeah, I completely agree with that. So if we want to turn the tide and turn that epidemic around, then we've got to talk. We got to talk hard conversations, and we got to have them often. And so for me, like, that's incredible that our school district has had that many conversations, and it's really amazing. And then if you add into that the center supports and then law enforcement with co-responder, I think we're going to have a huge impact over years here in Montrose. And so I'm really grateful for all of our partner agencies who, without any question, have all stepped out to participate in this program to support our youth. As far as ages for the center serves all ages. And so we will definitely do that. When we talk about youth suicide rate, we're really talking 10 to 24. So if the question was kind of like, what are we focusing on? We look at all youth, but when we're talking about that, the leading cause of death, we're looking at that kind of 10 to 24 age group.
Thanks.
So
one more question before you go on in our chat box. Is Safe to Tell available to anyone in the community?
That's a great question. Yes.
100%, yeah. And it doesn't have to be anonymous, you know. It's slick, you know, like you call in there. I try not to use what I normally say, but like, it's a really cool tool in that you call in at 11:30 in the morning or in the evening on July 3rd, and we're going to respond. You know, law enforcement's going to go out and check in on that family and that kid. School administration is going to get an email and a text. I'm going to get a text on my phone here at the district level, as is the superintendent. And then that building leader and that building safety team is also going to get it. So counselors are going to reach out from the school within, you know, that 12-hour period, but law enforcement is going to be there immediately to make sure that kid's safe.
Yeah, absolutely. Go ahead.
I was gonna say, and there's an app. So if you have your cell phone close to you, which most people probably do, you can download the Safe to Tell app. Well, I think we have an image of it coming up, but if we don't, I'll show you on my phone. And so you can get that downloaded so you have it, so that you don't have to look for it the next time if you need it.
It's incredibly easy to use, to Laura's point, the app. And there's also an 800 number. And just as Jim had said, it's anonymous, but it doesn't necessarily have to be. And the way it works is that once dispatch receives that Safe to Tell message, they let us know, or whichever jurisdiction that comes from, that report has come through to them, and we do send someone out to whatever address it is, or to try to contact the person that's in that report, so we can make sure that they're safe, or at least begin that frontline intervention or just that welfare check. So it really has been an incredible tool for us, because times past, people do wonder, how do I make this report without making things very awkward, potentially with a family member or a friend or things of that nature. And this is definitely a tool that provides for that anonymity. And that's a big deal for a lot of families and a lot of people who have friends and things who are having a mental health crisis or some other issue.
You know, Safe to Tell in Colorado's leading the nation in that deal. Our statutes protect the reporter. It's truly anonymous, supported by law, and it's a powerful tool to share concerns. And when we get a suicide concern, dispatch gets that. They're going to kick it to a responding agency, and they're going to kick it to the schools, and then we all interact in the same software to share information. So what? So we've told you about it, what it is, and so what's the takeaways from student threat assessment? Number one, you know, for us in Montrose County School District, it allowed us to return kids to school after they made a mistake with the right supports in place. So previous to this program, we were expelling for pretty much a standard 180 days or 365, depending on the level of the code of conduct violation. With this, we realized we stood up and changed our expulsion center We started an engagement center, and we figured out how most of our kids are getting back to school after an expulsion inside of 6 months most every time, and many times inside of 3 months, inside of a quarter. It gave us, I think that second bullet is one of the bigger ones on here. You know, it put the threats in context. You know, by the time they finish the level 1, we've talked to that family at least an hour and a half, right? With mom and dad, probably an hour, with the kid an hour. We've talked with all their teachers. We've talked with any witnesses involved. We've got hours of research and background on why this behavior occurred, and to figure out how to help that kid. By the time you go through level 2, you know, we probably chat one-on-one for more than, 4 hours. And they have a chance to tell us what they need. It also lets us talk between agencies, which allows for more appropriate referrals for service. And, I don't know if you guys want to hit any of the other bullets on here.
Yeah, I would say that that's incredibly true. It's a prevention program. It's a very good support for kids. And it's a program that I would want for my family, my kids, the kids that I care about in the community. So I just always say that, like, this is an opportunity to see really what's going on with a youth, and support them through a difficult situation.
I agree from my perspective, just on a personal level, seeing the engagement with the entire family as we work through these processes is very impactful. And also knowing that we rely not on subjective feelings or maybe impressions of what's going on. We really do rely, like Jim says, on the context of each situation, and also a very structured protocol so that we can make very, very good decisions for what solutions are best for these families with shared liability, so that we can inform our decisions with the information at hand.
And before we were like, you take them, you take them, you take them. Yeah. And now we're all together figuring out, no, we can do this, and this is how. And it feels really good.
So one of the other things that very quickly we realized was that providing youth access in their school to mental health services where they needed it, when they needed it, in a way that was easy for families, was a need. And so this year we've been able to, through a grant that the school district got, we are able to provide 2 full-time mental health clinicians from the center that are at the school every day, doing amazing work with our students and supporting them in a way that's easy for families and kids to access. So we now have school-based counseling.
Yeah, it was huge. Partnership with the center and having a positive effect, something that we're going to have to continue to pursue dollars for, and that we hope to expand, because there's definitely a need. And I already hit this. At the beginning, I think folks were like, it's going to eliminate expulsions. And for us, we're like, no, like when you really mess up, there's a consequence for that. But what it's done is it allowed us to get them back to their schools quickly. So there are choices of consequences, but choices don't define who you are. It's what you do after the choice that defines who you are. And this program really emphasizes that.
If you haven't downloaded the app, I would encourage you to do that for Safe to Tell. Then you can see, you can have your phone out, you can put in the support line for the center. That line is available 24 hours a day, and you don't have to wait for it to be a crisis. So it really is a support line. So if you're not sure what to do, if you just want to ask a question, if you're concerned about someone, please put that number in your phone, share it with friends. So if you've got it in there, you can put the center support line 970-252-6220, and then you can share that with someone if they need it. So that's available for you as well. And then you can reach out to law enforcement.
Yeah, absolutely. And I think, we do have apps for Safe to Tell. We have 1-800 numbers for Safe to Tell and things like that. But oftentimes we forget that there are actually emergencies where you need to call us immediately so that we can come and make a situation safe or lend some help. So we have a non-emergency line and an emergency line. Our non-emergency line is 970-249-9110, and that's to our dispatch center. And if ever you need to give them a call, they can find out which agency needs to respond to whatever call you have. And of course, if it's an emergency, you call 911. But what I like to tell people is that one of the things that's interesting, I talk to folks all the time, and sometimes they're reluctant to call law enforcement. And the interesting reason is because they're afraid that we're too busy to take another call. And I understand where people are coming from, and I appreciate that. But the fact of the matter is this is what we do. So I really encourage everyone, if you see something that you think is unreasonable, definitely give us a call, because my experience has always been, if reasonable people see something unreasonable, chances are it is. And also, don't be scared to have a tough conversation with someone that you think might be having some sort of mental health concern or suicidal ideation. That's one of the things that we found and we've seen to be pretty impactful as well. Have that frontline intervention, because you never know which intervention is going to make the most difference.
Last thing you can, obviously you can use Safe2Tell, but you can also just call our administrators or our counselors at our schools, or you can call right up here district office, and we will address your concerns. We promote Safe2Tell because it's an app. Know that if you get on that app and report, they will interact with you. It is manned 24 hours a day by the kayak in Denver, and they're going to start. It's fun to. Sometimes it's interesting to watch conversations they develop. They're going to try and get all the necessary information they need, because it is anonymous. They want to interact with you and get as much as they can before you disconnect. You can upload screenshots on there. You can upload photos. It's a really neat tool. So that's kind of our core presentation. I know Matt and Laura will probably say one thing. I'm gonna stop the share here.
While you're doing that, Jim, there are a couple of questions. The first was around the program's capacity for the non-English speaking population in the schools. And then the second one was around, is paying for it a concern or a block to receiving follow-up services?
Okay, I think I'll tackle the first one about language barrier. We are, I think our district is 40% Hispanic, and then around 60%, Caucasian, white, non-Hispanic. And so all of our buildings have Spanish speakers in them. My office up here, my assistant is bilingual, and that is a norm throughout all of our front offices. So yes, we do have the forms in Spanish for families and for the interviews that are conducted with them. And we have Spanish speakers, both native and, as a second language in all of our schools that can interact with families during this process. So on that front, yeah, we do have that built in. We try to do that with all of our programs, not just the student threat assessment, suicide risk assessment. The second question, help me out. We were talking about
Was funding. So none
funding,
of the
yeah.
programs we have talked about have cost to our students or their families. So if you need the crisis walk-in center services, the support line, the walk-in center, further crisis services, everyone can access that without any fee associated. So please know that. Our co-responder services are completely funded through a grant. That's also not a service that our community would get billed for. The programs that we talked about with the school district are also either provided in kind through our partner agencies, time and donation, or through grant. So great question. You can access any of those services. And I would, just as a reminder, again, the concern is very low. Certainly if there's a crisis, outreach through any of those lines of communication, and someone will respond, but you also don't have to wait. So if you have a concern, you can let your school know, you can let law enforcement know, you can let the center know. And that's really incredibly helpful for us.
the nice thing about having all these partner agencies at the table with the student threat assessment team is that also each of our agencies come with different funding streams. So a lot of times we're able to work with the family through those prevention dollars, or our special education services, or what. And we do keep a small fund associated with STAT where we've gotten donations for those little things that we just can't pay for through something else. We've used it for bus passes, library passes, even food coupons and things for some of the families we staff and staff that may not have another opportunity. So there is an opportunity to donate that we've had a couple agencies in town do. Or if we do training and we charge for it, that's where that money goes, right back into the staff program.
And we're pretty resourceful if our families have a need at finding a way to meet that need. So
This question may be a little out of any of our expertise, and we may have to get an answer back to the questioner, but will the recently passed suicide prevention and postvention law that Senator Quorum co-sponsored provide some funding for these programs?
I do not know the answer to that off the top of my head. I would have to research that and get back to you.
I think the House bill does do a really nice job of illustrating the need and the importance of addressing the concern. So I'm greatly appreciative of the leadership at the legislative level.
Yeah, we actually had the forward on that bill as part of our training that we just conducted, our annual training for threat assessment, suicide risk assessment. Really well written and a neat, particularly relevant for this topic.
There's a question in the Q&A, a little less maybe about actual intervention, more about maybe prevention, and it's around social media. And have you been able to address the problem of bullying via social media?
I mean, as a former school level administrator, now district level administrator, yeah, we deal with that every day in schools. Education around 21st century learning and citizenship, which is, they start getting those courses in the elementary school and it continues all the way through high school, where we're teaching them how to appropriately represent themselves online, as well as how to communicate more appropriately. The reality is, though, is they are teens. Imagine I've thought and reflected a lot over the years in dealing with teens about, imagine if when I was a teen, all the conversations I was having were documented that my parents could see, and that's essentially what social media and these text services are. Like you're getting a written record a lot of times of some of that exploration that they're doing. And so, the reality is, though, sometimes kids screw up in their communications and their conduct in social media. And when it meets the threshold for charges, we work with law enforcement. And then within the schools, we do daily conversations and discipline when necessary to address that. We are a one-to-one district. We have iPads available from kindergarten through 12th grade with different levels of permission set the whole way through. And we recognize that responsibility and work hard to partner with families to ensure kids are making good choices online. They are still teens, though, and so it's a process. It's not I don't ever see that you're going to be able to put that key in the hole and turn it and be like, we got that locked. It's constant conversation.
Have you given this presentation to parent-teacher associations or your staff or even to students?
Yes and no. This particular presentation would be no. This is relatively new. You guys are like in the initial surge of sharing. We really wanted to make sure we had enough data to present a realistic picture of what's going on with this program. Our schools know about the program. They know about. I've spoken personally to all of our schools about the suicide risk assessment, threat assessment. We've been training our administrators, counselors, school psychologists, special education service providers, and community partners for 3 years now, as well as the Uncompahgre BOCES. And those individuals go back to their schools and provide training to their staffs about the program. So yeah, the Montrose County School District staff is aware of it. We just did a board presentation 2.5, 3 weeks ago. I think it was probably a month ago in October. We presented to the 7 judicial district judges the other day, and the purpose of presenting to you is we want to start getting out to our community.
Well, and speaking of communities, and Laura, I think all three of you probably just spent a couple of days relevant to this question. Are you working with other county school districts to create similar programs or to replicate this program?
Yeah, we work with the 5 school districts in San Miguel, Ouray, and the West End. So Ouray, Ridgeway, Telluride, Norwood, and the West End School District. They participate in our training and participate every week in our standing level 2 team. So it's really amazing. We would partner with any school district who was interested. And even if we're not regularly partnering together, if a school district needs us or an agency, then we're happy to support anytime. And so that's available. I think it's really amazing. I think this program is a strength of rural communities like ours. I have spent most of my life in rural behavioral health, but I did do a little bit in Atlanta, which is very different, and other urban communities. And in bigger communities, oftentimes I found that there was a reason you couldn't do something. There was a barrier, there were too many players. And here in Montrose, very quickly, everyone was like, yes, we're at the table, we're ready to do this. And I think that really is a strength of our small communities' dedication and eagerness to work together to support our kids and our families. And so what we're doing here is unique. Like Jim and Matt were saying, I greatly appreciate you giving us this opportunity. We need our community to know that this is available and to reach out and to know that the school is a resource, that they're well-trained and they do this every day. And so if your student, your neighbor, your friend's kid has a need, to please encourage them, support them in making that call if they need it, but connect them with the schools or our agency or law enforcement so we can support that kid. Because oftentimes what we find is that by the time somebody reaches out to us, they've been carrying this for a really long time. And so we're happy to help them, but we could also help earlier if someone will reach out and let us know.
Yeah, I usually try to say this at one of the last things, but there's no harm in saying it a couple times. You know, my former life, I was an intelligence officer in the U.S. Army, and the way you prevent great evil is by reporting concerns. You know, I love, if it seems unreasonable to you, you're probably spot on. The worst that happens is that we report, that we investigate it and we determine there's no concern, or there's not much concern at this time. You know, there's no profile for, you know, a student that decides to do great violence at school. You know, there's not one fit, but they've done plenty of bystander studies right now, and 88% of the time somebody knew before a kid decided to do something horrible. And so, like, before they decided to shoot up a school or harm another student. And so if you have a concern, you need to report it. And there's a lot of ways you can do it anonymously, or you can do it without being anonymous. And we have this process that will make sure that the student in crisis gets help.
The only thing I like to add, I'm always on a big collaboration kick. And when Laura talks about rural communities and the relationships that can be built and the work that can be done and how special that is, it's because of the relationships. And without those, we definitely fail. And I think that's where we've been able to succeed, because everyone who comes to the table is genuine and open and honest and using the same nomenclature. And that helps us build a really strong foundation for this team to work. So in other places that may not be as easy as it's been for us because of how spread out people are, or maybe even because of how big a community is and how those relationships are hard to develop. But for us, it's been probably the most rewarding piece of it, at least for me, to see how well we collaborate, because it is a truly collaborative model. It truly is prevention-based. And as Jim said, any prevention-based model demands that information gets out early. And that's really what we seek to get, so we can address these things before they become bigger.
What other questions?
You'd think after all these months, I'd remember that, but I don't have any more questions. We do have one, it asked about presentations for students, and I think, Jim, you said you were just at the cusp of getting these presentations out, and there may be a time where you can do it for you.
Yeah, I think the last time I presented with kids was, it's been a few years, but I have presented to kids in the past. The pandemic has thrown an interesting, challenge in the deal for the last year. That's been a primary concern. And truly last year, our risks, the reported went down, as everybody's back in school, we're kind of back on the norm from the first year. I think we're going to be doing around 200, 250 suicide risk assessments annually, and somewhere in the neighborhood of 80 to 120 threat assessments every year. And so, that's where we're headed. We want to make sure our community has an idea of this, our families, before we start talking to the kids about it, because, ultimately the kids are going to go home and talk to their parents about it. And, we do feel a burden to inform in the right order. My final thing before is that this is the most important thing we do to mitigate risk, and keep our students safe. In my brain, suicide is it takes a community effort. I like what Matt and Laura were saying. We live in Montrose, and we all know how to work together, despite what is on the national news cycle and what sometimes percolates down in our community. And we are a powerful force. This team has just given me such respect of our community agencies and the people in this town that are trying to help others. And so I just encourage you to remember that we live here, and this team will work to keep our kids safe. And so we need you to report your concerns. We're going to treat everyone fairly and get them the help they need.
Yeah, well, thank you. I don't see any more questions, but there are 3 comments, and I do want to read them because I think it really sums up, it's certainly how I feel in your generosity tonight of giving up your time. One comment was, this has been a great presentation about an even greater program to address a very serious issue. Thanks to all of you for your efforts. Another individual said, nice work. And then the third one that just came in was, great information about a fantastic program. Thank you for presenting to us.
Thanks for having us.
Thanks so much for making time to come tonight.
Yeah.
And please share.
Yeah, please share.
Yeah, and then just one last comment was that they hope that you can do some safe to tell presentations for parents. They'd like to see that as well.
We definitely can do that. Mm-hmm.
All righty. Well,
all right. Thank you.
Yep. On behalf of the League of Women Voters, the Uncompahgre Valley, and the Center for Mental Health, thank you all for joining us tonight, and we appreciate your time.
Thank you. Have a good evening.
Thank you.